Yeah, so I've got what's called temporal mandibular joint dysfunction, TMJ, without displacement, which means that the disc on this side has moved forward. Most people can open their mouth about 3 fingers wide. I can barely open 2 fingers wide, and it's constant pain. Well, so it took a while to figure out what the problem was. I had initial pain about 2 years ago, and I went to see my dentist, and he thought it was stress. My dad had passed away, and I had traveled back to Saskatoon about 3 times, and I was eating sunflower seeds to keep myself awake, and I thought, oh, just wear on my jaw. So he tried some muscle relaxants and tried adjusting my bite and all kinds of stuff, and cold and heat, and nothing seemed to work. And so finally he sent me to a specialist, and the specialist looked at it, and finally with a CT scan said, you know, your disc has moved. And so my insurance covers most normal dental work, fillings, crowns, that kind of stuff, but it doesn't cover TMJ issues. That's $5,000 to fix it. And it's like, I just don't have $5,000 kicking around. And so I'm trying to figure out, well, how am I going to address this issue now? It's something I've dealt with now that I know what it is, for 6 months. I haven't made the decision to figure out how to get it fixed. Well, it would, when I heard that the province was bringing it to the attention of the federal government to maybe bring it into covered under MSP, I thought, you know, that's something that's great. It's the only joint on your body that isn't covered by medical service plan because it's considered dental work. And so if you have an issue like this and you have no coverage, you're stuck with it, or you have to try and figure out how to raise money, or you have to come up with a payment plan with your dentist, or you live with it. And so it's, you know, I think it's a good idea. It's, you know, oral health is part of your overall health, and if it goes down, your overall health goes down. And at some point in time, if it becomes so chronic, it can be elevated to be an MSP plan, but by then, years have passed, and your health has probably declined so much. Why do we have to get there?